Hi, this is Rowdy. He's my patient. I'll be the occupational therapist, and I'm going to just take you through some tests. This is Yachty. He's right here. So the first test is called the DASH test, which is a 30 question questionnaire, just kind of talking about how well you're doing with your activities of daily living, how you perform the activity. It doesn't matter if you use the affected side or not. You can totally be avoidant of that affected side, but just how well you're performing that activity. So you'll give this to the patient, they'll fill it out, you'll answer any questions they'll have, and so just remember that it's within that first week. It's good for OA, RA, rotator cuff tears, fractures, elbow fractures, and arthroplasty, and as well as wrist disorders. And I got all this off the SRA labs measurements. And the first test we're going to do on Rowdy is called the empty can test, which assesses the supraspinatus to see if there's any tears or weakness. It's good for shoulder impingement as well. So I'm going to have Rowdy go up to a 45-degree angle. And then I'm going to have him act like let's move you over just a little bit so the camera can see. So he's going to empty his cup like this, and then I'm just going to stabilize the shoulder and press down. And he passed, and you asked, do you have any pain with that? If he were to have pain, that would have us indicate that it's probably a supraspinatus tear or impingement going on. It helps rule out some things. It doesn't diagnose them, but it helps us as therapists to know what is going on in the shoulder. The next one is called the belly press. And so he's going to press on his belly like so. You're going to have a little bit of internal rotation in that. And I would come in and pull while he's pressing. And if he had pain with that, that'd be a positive test. And what it's testing is a subscapularis in there. And so inability to do this, or if he was going to let me come out, that was showing weakness of the subscapularis. And the next one is called the speeds test. Really easy test. So I'm going to have Rowdy have his hand out to the side like this, palm up. And as he comes up with his arm, I'm going to add some resistance. Not a lot of resistance, just a little bit of resistance. And I'll have you go up. Keep going, keep going, keep going. All the way up. And so I'd ask him, do you have any pain with that? And what that testing is the long head of the bicep, and you're looking for tears or inflammation with that. So if he was having trouble, like maybe he couldn't even do it, or if he was just having pain with that, that'd be a positive test as well. Next one is called the sulcus test. And so you roll up their shoulder sleeve a little bit. And what a sulcus is, it's a divot or an indentation of the arm. And so Rowdy's going to have his arm just relaxed by your side, and all I'm going to do is pull on it, and I'm just looking for an indentation right here, and what that's showing is instability of the inferior aspect of your shoulder. Bad for if you could dislocate your shoulder out of its socket, and so you want to prevent that. So he is not showing signs of a positive. He actually has pretty good stabilization there. Next one is the Neers test, and it's testing for shoulder impingements. And so what you do is I have them relax their shoulder. I'm going to internally rotate it, so like I'm emptying the can, and then I'm going to bring his arm up. Relax. I'll just bring his arm up, and I'll say, are you having any pain with that? And so if he is having pain, then he could also rule out if it's the supraspinatus or not, but you know that something's going wrong, but he's not having any pain with it, so that's a good sign. And so when you do that, I've watched some videos that say, like, don't let them know that you're going upwards, that way they can't help you out with the, sorry, my dog's like getting into stuff. Don't help them out, or don't tell them you're moving upward, because they can sometimes help you move upward, and that's the opposite of the point we're trying to make, to see if there is going to be pain when you do it just with passive range of motion. However, I don't really like that aspect, because if there is some pain, or if there's something going on, I don't want them to jab upwards and then tear it further. So I like to give them a little bit of a leeway and kind of judge if they are helping or if they aren't. The next one is called the Adson test, and it's testing for thoracic outlet syndrome. And so you're testing that impingement of the brachial plexus going down your arm. So what you're going to do is you're going to have your arm extended, slight external rotation, slight abduction, and I'm going to palpate the radial pulse. And then I'm going to have ready, will you extend your neck, put your neck backwards, look towards me and my arm, your arm, and then take a deep breath in and hold it. Okay. And so what you should feel if it was a positive test was you're going to feel less of a pulse in the radial pulse, or you're not going to feel a pulse at all. And so that's a positive sign of the thoracic outlet syndrome. And so let's just move on to the next. The next one is called drop arm test for rotator cuff tears, specifically the supraspinatus. It also tests for tendonitis. So I'm going to passively move the arm up to 90 degrees abduction with his palm down. You can't see it, but his palm is down. And so I'm going to tell him, ready, I'm going to let go of your arm, and I want you to slowly bring your arm to your side. And so he tested negative. He did a good job with it. And so if it was positive, they would drop it, or they would see that they get to a certain point and then they drop it. And so that's showing weakness. That's a positive sign of the supraspinatus either being torn, or if they have pain with that. Did you have pain with that? If they have pain with that, then that's another indication too. Next one is called the Roos test, or Roos test. It's a thoracic outlet syndrome test again. So with this one, you might get a lot of false positives with it. So there's not a lot of reliability in it, but you can just use it to indicate if, it's a quick test where Rowdy's going to come out like a butterfly, a little bit of posterior. And so he's going to move his hands on both sides. He's doing this on both sides. And so he's going to do this for 3 minutes. And so what a positive sign will be if he is experiencing pain or tingling or numbness in his hands, or if his shoulders start to come downwards, which would indicate weakness. That would show a positive sign as well. But remember, with this test, there's a lot of false positives, so it's not the only indication that there is a diagnosis of thoracic outlet syndrome. So you can stop. I won't let you go any farther. So the last one, called the Gerber test. It's focusing on subscapularis tears. And so what you're going to do is you're going to have your arm on your back like this. And would you stand for me, ready? So you're going to have your arm on your back. And so what I'm going to have them do is lift off, or move your hand away from your back. Good job. And you're going to test both sides to see if there's any weakness. Go ahead, lift off. Perfect. And so if he couldn't lift off, then that was a negative sign. Or if he couldn't lift off, that was a positive sign, meaning that he could have a subscapularis tear. But he did good on both sides. It's important to test both sides just so you see what's regular for them, or if there is something happening with both shoulders that you need to keep in mind. So this is all the tests for shoulders.